Next speaker of this webinar, Dr. Dhaivat Upadhyay, is trained at the Adasong International Academy of Homeopathy under the guidance of Dr. Rajan Sankaran, Dr. Jayesh Shah, Dr. Sujit Chatterjee, Dr. Sunirmal Sakkar, and many. He completed courses like basic course, certificate course, and master course in homeopathy. He's presented his cases in Arsenal of HMAI. He's trained under his father, Dr. Samir Upadhyay, and working independently with him in Surat. He's also attached with CD Pachigar Homeopathic Medical College and Hospital as a physician and lecturer in the Department of Repertory. There's a faculty in Homeopathic Learning Group, where he's teaching students of all over the India. Now, Dr. Dhaivat will take upon the session. Welcome, sir.
Hello, good evening. Fine. Am I audible?
Yes, sir, yes.
Okay, fine. It is visible, screen is fine. So, first what? We have the opportunity to do more good in one day than most of people have in a month, because we are the homeopath. We are the physician. So, good evening, friend. Myself, Dr. Dhaivat Upadhyay from Surat, Gujarat. This is our team. My father, Dr. Samir Upadhyay, Jetashri Upadhyay, Dr. Manthan Upadhyay, myself, Dr. Dhaivat Upadhyay, and my wife, Dr. Khyati Upadhyay. This is my clinic. First of all, I would like to thank Hope Academy and the other song for giving me such wonderful experience, wonderful chance to share my experience, share my learning with you. I feel very fortunate that I learned from the other song academy under the master like Dr. Sankaran, Dr. Jayesh Shah, Dr. Chatterjee, Dr. Gajanan Dhanipkar, Dr. Gaurang, Dr. Rishi Vyas, Dr. Devang Shah, and many more. It was very, very wonderful experience in other song. So, which quality are needed in homeopathy for successful practice or successful physician? Anyone? Which are the qualities? Proper case taking, yes. And patience, one should be dedicated, yes. Observation, good observe, yes. Unprejudiced observer, yes. Being flexible. First of all, believe in yourself, believe in homeopathy, that homeopathy can do, you can do. Determination, dedication, and hard work. These four qualities are very important for become a good homeopath. So without wasting just time, we have only 45 minutes. Shall we start with the case? So case 1, case of brain stroke. On 24th February 2018, a student of homeopathic college rang me that my mother developed a left-sided hemiplegia. She was diagnosed as a case of acute brain hemorrhage. Can you help her with homeopathy? I visited her in hospital named INS in Surat in the afternoon around 2:30 p.m. She was on ventilator, blood pressure was around 130/90, and she was complete unconscious. I thought that brain hemorrhage, it will end with the arnica or helleborus or opium or lachesis or gelsemium. I will not find anything more than these 4 to 5 or maximum 10 remedies. I just visited her. And what her son said, suddenly when she woke up around 5 a.m., she had vertigo with headache and she fell down. She became unconscious and was admitted into hospital. Just read all the line. What I asked, what happened before she developed this problem? Any emotional disturbance or any that happened? What he said, a day before yesterday, we had a serious discussion in our house regarding the elder brother's marriage. As he had an affair and he wanted to marry a girl from outcast. Mother got angry, but she did not react at time. She did not spoke a single word, but she got hurt and went into room and slept. Understood the incident? The day before yesterday, they had a serious discussion about her son's marriage. She got angry but did not react. She got hurt a lot. As soon as in morning at 5 a.m. when she woke up, she had severe vomiting, headache, and she fell down. I just examined her. In every hospital case, if patient is unconscious or conscious, I examine whole body from head to toe. Coldness or icy coldness of the left side of the body, while right side was warm. Perspiration on forehead only. Pulse was around 86 per minute. Respiratory rate 22, and blood pressure was 130/90. So I asked her son that tell me about her basic nature. Tell me about her as a person. What he said, she is extremely caring and very anxious about everybody in the family. She gets worried very small thing. She gets tensed up if anything happened to any other family member. She is not anxious only about family member, but she gets worried about all the relative. She is very helpful to everyone. If she hear any news, any bad news, she got tense and she just rushed to their house to help them. She does everything for them. She goes out of the way and help them. But doctor, one thing, she is patient of migraine. In spite of having severe headache, she never care about herself. But if we from any of from our family, if we get slight cold or fever, she get tense so much that just you go to the clinic and take the medicine. But she never care for herself. In spite of severe attack of migraine, in spite of high grade fever, in spite of any other complaint, she never care for herself. She is very sensitive by nature. She get offended very easily, cannot tolerate anyone to talk her harshly or rudely. She become very sad if someone talk rudely, but she never react. She never gave back answer to anyone. She keeps everything inside and brood over that. She weeps very easily. If she heard some bad news about anyone, she get anxious and weeps. She is very much sensitive to bad news that affect her a lot. She is very sympathetic to everyone. And thermal was chilly. This is the report. Am I right? So now what to do? Hmm? Simple case. Before starting the case, I was prejudiced. I am frankly telling, I was prejudiced that this case will end up with the arnica or opium or Helleborus or lachesis. But my vision was changed completely after hearing the whole story. Just tell me the rubric first. Don't jump with the medicine. Medicine will come. Remedy will come. Just tell me the understanding or rubric. Tranquility, anger after. Anger, suppress, ailments from suppress, anxiety, family about open date easily. Yes, brooding, ailments from anger, suppress. Yes, yes, very good. Right side is cold. Left side is cold. Mm, mm. Anxiety, conscious of anxiety, family about whips easily. Yes, very good. Mm. Coolness of affected part. Yes, Dr. Premlata. Very good. Headache with vertigo. This is common symptom of brain stroke or brain hemorrhage. Anxiety about anger, suppressed emotion, brooding, emotional, introvert. Yes, yes, very good. Suppressed emotion, brooding, sympathy, careless about herself. Yes, Dr. Sonal. Hmm. I see coolness of the left side, sympathetic. I think everyone is clear with the remedy. Very simple. Hmm. I said first, remedy is not important. How to reach to that remedy? I never ask remedy to my sir or to my guru. I only see how they reach to that remedy. Because same case will not come with me. If we understand the path to the destination, we can deal with every case. Understood? What my father told me when I passed out from the college, that you cannot walk every time by wearing other shoes. You cannot walk every time by wearing other shoes. You have to wear your own shoes. Same thing, you cannot apply same method to the every case. You have to change the method according to case. You have to make your own homeopathy. अपने वाली homeopathy बनाओ. Understood? We cannot apply one method in every case. We have to change the method according to case, according to patient. Learn from everyone. Learn everything. Okay? So, causticum, any other? Hmm? Oculus, yes. Phosphorus, yes, yes. Pulsatilla, veratrum, natrum carb, carcinosin. Good, good, very good. Ignatia, phosphorus, yes. Hmm. Kali, medorinum, Kali carb, yes. Stephysagria, very good. Oculus, yes. Stephysagria. Hmm. Shall I show my analysis? Hmm? So here, what I did, I just make the sectorial totality. What is sectorial totality? Hmm? In one clipboard, I put physical rubric. In other clipboard, I put mental rubric. And another clipboard, I put physical general. I did sectorial totality. So what I did, first I took physical rubric because it is the emergency case, life and death, case of life and death. So we have to rely on physical rubric first. So I took first clinical apoplexy and clinical apoplexy one side, clinical apoplexy perspiration with head injury ailments from head, brain, hemorrhage brain, extremity paralysis left, extremity paralysis, apoplexy after, Then, this is very important. Paralysis, coldness of part with. Coldness one-sided and coldness affected side. So, I got Nux vomica, cocculus, rustox, lachesis, belladonna, aconite, and so on. This is complete repertory. Then, mental rubric. First, anger, ailments from aggravate, grief with silent. Understood? Anger, ailments from aggravate, grief with silent. Here, there is no only anger suppressed. She got hurt a lot, but didn't react. Disappointment, ailments from aggravate. Cares, worries full of. Sympathetic. Anxiety, others for. Anxiety, health about relative of. And last rubric. Anxiety, health about relative of. Little concerned about his own. Dr. Vismay said very rightly. The only remedy which came is cocculus. When I combine all the rubric, the one remedy which goes through and through is cocculus. Understood? Any doubt? Any doubt in cocculus? So let's see the follow. I give cocculus 1 m, one dose every 2 hourly, apply on the skin. One dose at 7 p.m. and second dose he applied at 9 p.m. on 24th February. On 24th Feb means on same day at 10 p.m. I got the message from her son. Then she seems to responding well within 3 hours. Just see how homeopathy work, how fast it work. It seems to be responding. So I advise to continue the same medicine every 2 hourly. On 25th February next day, I received message in 7:15 in the morning that she has improved. Left sided of the body is warm now and consciousness is also improved. This is WhatsApp chat. On 25th February, what he said, do I need to continue repeating dose? She has improved. Left side is also warm now and consciousness is also improved. I just visited her now and there is no fever because she was on ventilator. So I have to apply on the skin only. She was on ventilator. Okay. I just apply one drop here. On 26th Feb, on third day, hi Dhaivat sir, so far progress is good. There is drastic improvement. I just visited her. She talked with me for 15 minutes on third day of medicine. She talked with me for 15 minutes. Thanks for your help. Fever cleared yesterday. They removed ventilation as well on third day. अभी 48 hour भी नहीं हुआ है. What he said, they removed ventilation as well. On fourth day, I asked, how is auntie? She is improving gradually. They plan to remove EVD tomorrow, which is extraventricular drainage. Swelling is also reduced, confirmed by CT scan. She is talking properly on fourth day. On fourth day, the report showing the fourth ventricular hemorrhage appears to be resolved. On 1st March, she moved to the HDU, which is high dependency unit, which is close to the ICU. So now she was better, she was improving. So I advise to continue cocculus 1 m at every 6 hourly. On 2nd March, no drowsiness. She took proper sleep, but complaining mild headache. So ask him to continue with the same medicine. On 3rd March, headache was persistent. EBD was removed on 2nd March. She was advised to give arnica 31 dose due to injury. After removing the EBD, due to injury, I gave arnica 31 dose. What he said? Yes, I gave one dose at 8:30. Around 9:15, she stopped complaining about pain. On 4th March, she was complaining about that she sees black dot or black spot on turning her head. Now what to do? It is troubling her a lot. So many black spot in front of her eyes. She cannot do anything. It is troubling her a lot. Now what to do? Wait. Yes, I can wait, but it is troubling her a lot. If it does not trouble the patient, we can wait. Just wait and watch, it will be clear. But as it was troubling, we have to give some remedy. Retake the case, okay, okay. Or what to do? New symptom. Repeat calculus. On which base? SL. Okay. Or so I took following rubric: vision black moving with the motion of eye, and vision black spot floating, muscia voluntis and most voluntis. What is musk voluntis, most voluntis? There are the small black insect-like vision. When I took this rubric, the only remedy which comes is calculus. Same step. I gave calculus 200 single dose because it is on less important plane. The disease is shifting from more important to less important organ. So I just give calculus 200 single dose and she was better next day. So what is calculus? In Murphy, dim vision with the black spot before eye or dark spot before eye. This is written in Murphy Materia Medica. On 7th March, she was discharged from hospital. What he said, she is now able to walk on her own, started doing household activities. Back to normal condition, active and good memory, short term as well as long term. General good, sleep good, appetite, able to walk slowly. Now she can do everything on her own. Now what is calculus? The sphere of action of calculus are many spasmodic and paretic affection, notably those affecting one half of the body. Affection of cerebrum. It is a stupefying poison, hence it caused the disturbance of the sensorium and affection of the cerebrospinal axis, producing paralytic muscular relaxation with heaviness. The patient is very susceptible to the fear, anger, grief, and all the mental disturbances. See the ill effect of anger, fright, grief, anxiety, and disappointment. Calculus person are very sensitive to the suffering of other, sympathetic, alert, and anxious for the feeling and health of other. This is calculus. This is how homeopathy can work very fast. I can show you so many cases of hospital cases. Where homeopathy work so fast. where other doctor lost their hope. Now we cannot do anything. And homeopathy shows their miraculous result. My grandfather case, uh, same, a brain stroke. Doctor said at the age of 83 we cannot do anything. In the morning around 11 a.m. complete zero movement of the one half of the body. When doctor came to see him, he said we cannot do at this age. He will be bedridden for whole life. I told doctor give me 4 days, only 4 days. I start medicine every 1 hourly. When doctor came again on the round at around 4 to 5 p.m. in evening and asked, how are you, Dr. Shailesh? And he raised same hand. I am fine, doctor. Within 4 hours, he raised same hand, which was completely paralyzed in the morning. Within 4 days, he was walking, and within 1 month, he started his clinic at the age of 83 years. After severe brain hemorrhage, brain stroke, he started his own practice. So, what do you want to see? Now, the skin case or any other case, another pathology. How to start to read using only therapeutic approach. What I say, no any case is same. We have to change our approach according to case. Understood? I use therapeutic approach only if I didn't get any particular peculiar symptom. In any hospital case, I just ask patient or patient relative just apply 1 drop or 2 drop on the wrist or on the forehead or here. These are the pulse point. So medicine will affect very fast. Okay. So you want to see another pathology. You want to see another pathology. You want to see that pemphigus vulgaris case, or you want to see psoriasis case. Other pathology. Okay, fine. Then we'll see pemphigus case also if time permit. Okay, fine. The case of arthrogryphosis. We'll see pemphigus case after this. Okay, the case of arthrogryphosis. First, we see what is arthrogryphosis. Arthrogryphosis multiplex or simple arthrogryphosis describe the congenital joint contracture in 2 or more areas of the body. Children born with 1 or more joint contracture have abnormal fibrosis of the muscle tissue, causing muscle shortening, and therefore are unable to perform active extension and flexion in the affected joint. If it is affected only 1 or 2 joint, the prognosis is very good. But here this patient having arthrogryphosis of all the joint, contracture of all the joint. So pediatric or doctor tell that there is not a good prognosis. Okay, जब तक रहे जिएगा ऐसे ही जिएगा, थोड़ा सुधार होगा. So they came to me that if homeopathy can do anything or not. So this is the case. Baby girl aged 5 months came on 21st May 2019 with the complaint of not gaining weight and stiffness of all the joint of the body. At the time of birth, her weight was around 2.8 kg, and after 5 months on 21st May, her weight was around 3.8 kg. Just imagine the baby. Within 5 months, he gained only 1 kilogram. She cried late after birth with cyanosis and pallor +2. which is mentioned in doctor's report. Tachypnea and distress of respiratory system. Placenta around neck during birth. Abdomen is enlarged and limbs are emaciated. She passes stool immediately after feeding, and stool is very sticky, very loose, watery, and offensive. Mother's history. Just pay attention to the mother's history. Mother had sterility, so she took 8 IUI and 2 IVF without positive result. Then she conceived naturally. During pregnancy, she had tremendous fear of miscarriage. Tremendous fear. What happened if this miscarriage happened? What happened? I feel lonely. No one with me during whole pregnancy. My mother-in-law didn't care. When I need everyone at that time, no one were with me. Till today, even during feeding, I feel that I am alone. No one is with me. I will translate in the English. ભગવાન એકદમ હેલ્ધી બધાને એકદમ હેલ્ધી બેબી હોય છે, પણ મારી સાથે જ કેમ આવું? ભગવાને આખી દુનિયામાં મારી સાથે જ કેમ આવું કર્યું? બધાને પ્રેગ્નન્સી રહે, મને તો પ્રેગ્નન્સીમાં પણ પ્રોબ્લેમ, અને પ્રેગ્નન્સી રહી તો મારી સાથે જ કેમ આવું? And history of severe blood loss during pregnancy. What she said, everyone has a healthy baby, but why not mine? Why God has done with me only? Everyone gets their pregnancy so easily. Why I can't? Why there is such a problem with me only and my baby? Why? And after all this, when I have conceived, then why only my baby is like this? Understood? And history of severe blood loss during delivery. Family history of allergy, diabetes, and hypertension. This is the case. Now, what to do? Yes, why knee, Dr. Park? 4-second filling, yes. Delusion poor, yes. 4-second filling, unfortunate filling, yes. Very good, Dr. Premlata. Neglected, 4-second. Hepatitis mother case during pregnancy, yes, yes. Then child symptom, yes. Mineral kingdom. Feeling lonely. Anxiety darkened. Delusion unfortunate. Anger. Hemorrhagic tendency, yes, yes. Yes, very true, Dr. Premlata. Single out. Cares desire for. Suffered wrong. Fear of miscarriage. Dr. Priyanka, this is very common. Fear of miscarriage is very common. Patient had already 8 IUI and 2 IVF without positive result. So fear of miscarriage is very common. Understood, Dr. Priyanka? It could be a remedy for sinuses of newborn. Yes, doctor. I don't know how to pronounce your name. Disappointed. Yes, Dr. Yogita. Why I? Mineral. What is the main theme of mineral? Making, breaking, laking. Understood? Making, breaking, laking is mineral. Me versus you is animal. And sensitiveness is plant. This is the common understanding. Dr. Janice, animal kingdom. Is there any issue of me versus you? Then they are better than me. I am lower than they are. Yes, plant sensitivity. Unfortunate feeling. Theme of snake. सिर्फ स्नेक में ही अनफॉर्चुनेट फीलिंग है. इजी ना अनफॉर्चुनेट फीलिंग. थीम ऑफ स्नेक. कॉर्ड अराउंड द neck during birth. You can think of legacies. Easy na. Depressed miasm. Yes. Shall we go further? देखते हैं एनालिसिस. फाइन. देन अपन वो भी देखते हैं अपना कौन सा केस पेम्फिगस का. ठीक है. सो आई टुक फर्स्ट हेड एनीमिया ब्रेन. दिस इज वेरी इंपॉर्टेंट. He didn't cry immediately after birth. So there is lack of oxygen to the brain. This is very important rubric. Hypoxia, yes. Head anemia brain. Ask every child if she cried immediately after birth. Head anemia brain. Then clinical cyanosis infant in. Extremity emaciation. Emaciation children in. Rectum eating after. Rectum diarrhea eating after immediately. Delusion deserted 4 seconds. And unfortunate feel. The remedy which came was China. And at that time, I was working with the Nair Repertory. So I thought, let's open the Nair Repertory and let's see what is mentioned in Nair Repertory. So I opened Nair Repertory. It is visible. Repertory is visible. Hello. Fine. So I opened Nair Repertory, and in Nair Repertory, there is very good chapter of pregnancy. This is chapter of pregnancy. And where to see? Pregnancy, infant. Open infant and open asphyxia. Pregnancy, infant asphyxia. The first rubric, after great loss of blood by the mother or if infant is pale. The whole case in one rubric. The single remedy which gave is China. Understood? Whole case in one rubric. This is the beauty of Nair. I will show you so many cases of Nair repertory. Understood this rubric? Infant asphyxia after great loss of blood by mother or if infant is pale. Single remedy is China. So I gave, this is the same rubric of Nair repertory. So I gave China 200 single dose. China 200 single dose and SL for 15 days. After 15 days follow-up on 6 June, she was much better. Weight is 4.4 kg. Almost 1 kg increase in 15 days or 20 days. Stool becomes solid and frequency reduced. So I gave Saclec and SL for 1 month. After 1 month, weight was around 6 kg. Overall, much better. She had diarrhea with bloody stool and treated with antibiotics by the pediatrician in Nadiad, as she was staying 300 kilometers away from Surat in Nadiad city. So they took help of antibiotic. Then she developed constipation with flatulence. So I again repeat China 201 dose. On 20th February, the weight was around 10 kg. Started sitting. She tried to walk with support. She is much better. No diarrhea, stiffness of joint is. Saclec means rubrum. Saclec means rubrum. Okay. It is nothing but rubrum only. Saclec means. She is much better. No diarrhea, stiffness of joint reduced. Still under treatment. Now she was off the treatment. She can do everything. She started schooling. These are some photos. These are on 7th month. On first year. Photos on 1 year. She can do everything at the age of 1 year. Medicine given to baby. बेबी को तकलीफ है, मदर को देखे क्या करे अपन. At the age of 1 year, she can do almost every activity. And this is recent photo. Completely normal. Where pediatric says and doctor says जितना रहेगी हो सके उतना ठीक रहेगा, कंप्लीट ठीक नहीं होगी बच्ची. So you want to see another case of pemphigus? Another case of pemphigus or shall we end? Okay, fine. फटाफट देख लेते हैं, ठीक है. I went to see a 60-year-old man on 9th April 2019 with a bullous pemphigoid on the whole body for last 1 month. Before 1 month, he had a boil on left feet and then it developed very suddenly. Even the pemphigus is developed in mouth also. I cannot take any food. It is very painful, doctor, please do. I cannot drink a sip of water. Severe burning. Amelioration by warm application, offensive discharge, yellow sticky discharge. One of my patient friend told me about you. पर मैंने आपके बारे में सर्च किया और 5 जगह पे आपके बारे में और होम्योपैथी के बारे में पूछा. My patient told that start homeopathy with Dr. Dhaivat. But I did research about you and homeopathy. As is there any scope of homeopathy in pemphigus? And what about you? How is your practice? How is your method of giving medicine? I just did research and then I start homeopathy. What he said, I cannot tolerate slightest touch. I feel guilty. I did something wrong. और उसकी सजा मैं भुगत रहा हूं. I did something wrong. और इसकी वजह से ही my life will destroy. Due to this problem, my life will destroy surely. Now I become completely helpless. I have to take others' help and I don't like it. Before 15 years, I had psoriasis and I took allopathic treatment and then I was completely better for 15 years. But before few days, I took some Ayurvedic kava and after that, few spots of psoriasis reappear. He is very much time punctual and very perfectionist in everything. Even I am very much perfect about my clothes, my appearance. It should be perfect, neat and clean. Every day I do shaving, hair wash, oiling. I keep myself very particular. I am very particular about my routine. If any work came out of the routine, then I get stressed. Now, what will I do? How will I manage? It is out of the routine. I cannot manage. I am extremely careful about his health. He keeps all his old files very perfectly and particular. I check all the doors and windows before going to sleep. He always recheck his work. Always recheck his work. He never sit quietly until he finishes his work. He never sit quietly until he finishes his work. What he say? I never sit on backside on two-wheeler. I doesn't have trust on anyone. मुझे गिरा देगा. I doesn't have trust on anyone. I always follow rule. Even I don't keep my vehicle on side stand as it is not in the rule. I always keep my vehicle on double stand. Constant stress about financial matter. I have constant fear that what will happen if I lost my all the money. I never invest in stock market. I don't have faith, don't have trust on market. I always invest my money in secure place. I have lots of insurance. Anything happen anytime. Personal history desire spicy, aversion not specific, stool constipated, thermal hot plus. This is the case. Now what to do? Kali Brom, God's only Vyanjan. Kali Brom. Arsenic, yes. Very simple case. Very simple case. Lachesis, fastidious, yes. Kali first, Kali. Give me rubric, will give me rubric. Will not rest until things are done. Give me rubric for that. Don't give medicine. Give me rubric. I want rubric. Medicine is very clear. Medicine is very easy. Fastidious, checking thing twice. Trust issue, suspicious. Desire to remain in bed, workaholic, restless, perfection, insecurity. Very good. These are the symptom. I want rubric. Fear, poor poverty of excellent Dr. Minal. This is yellow sticky. Fastidious, yes, Dr. Gita. Anxiety, money about, yes, Dr. Shruti. Anxiety, yes. Rest cannot when things are not in proper place. Exactly, Dr. Jagruti. Delusion, wrong he has done. What she say? Due to this problem, my life will get destroyed. My life will get finished. Tell me the rubric. Due to this problem, my life will get destroyed. Just tell me the rubric. Delusion ruined. No ruin. Dr. Jagruti. You are very close. Here there is no delusion ruin. What is ruin? My life is already destroyed. This is ruin. But what he said, it will be destroyed. Delusion ruin only 4 or 5 remedy, Ignatia, Calcarea, and to another medicine. Ruin she will be only pulsatilla. Delusion doomed. Yes, Dr. Gaurav. So open the क्या बोलते dictionary and see the meaning of doom. Doom, doom. Let's see doom. Are you able to see? The dictionary? Are you able to see? Okay. What is doom? Death or destruction or some other terrible fate. Fate means what? Fate means future. Death or destruction or some other terrible fate. This is doom. Delusion, doom, excellent rubric. Or no longer having seen. Okay, loathing of life. Loathing means hatred of life. Here there is no question of about hatred. Hatred of life. Now I hate my life. There is nothing which I love in my life. I hate my life. It is loathing of life. One of the very good remedies, antim crude. So let's see the first photo of the patient. Are you able to see the pemphigus? Yes. Just see, just imagine the condition of the patient. Just imagine. This is leg, full of pemphigus, vesicular eruption. This is shoulder part, axilla and shoulder, full of vesicular eruption. Just see the whole body. Just see this on back, on abdomen, on chest, on hand, everywhere on whole body. Even in mouth, full of vesicular eruption. Just imagine the patient. Just imagine his condition. You see, this is the patient. See the patient. Cannot do anything. Now, let's see the analysis. What I did. First, objective reasonable. I will explain this rubric. Then delusion wrong he has done. Delusion doomed being. Helplessness. Work routine desire. Fear poverty of. Fastidious appearance about personal. Then rest cannot when things are not in proper place. Suspicious and anxiety health about. Then physical rubric. Eruption pemphigus, eruption discharging moist yellow, eruption discharging moist offensive, and skin itching washing warm ameliorate. The only remedy which came was arsenic, simple remedy. Understood? Any doubt? Why I took objective reasonable? Can anyone tell? Why objective reasonable? Anyone? One aspect never changed the remedy. Yes, he did survey. He wants to do homeopathy. But he did survey, he did research about homeopathy. His objective was clear that I want to take homeopathy only. But it should be reasonable. There should be some proof that homeopathy can work on this case, that homeopathy can help to this case. That is objective reasonable. बहुत सारे पेशेंट आते हैं ना, किसी ने ये बोला तो मैं ये जाके ये किया, किसी ने आयुर्वेदिक बोला आयुर्वेदिक किया, किसी ने बाबा का बोला तो मैंने बाबा के पास वो भभूति भी डलवाई मेरे पे. Just tell me the rubric. Some says that take homeopathy. I go and I went and take homeopathy. Even someone says that take Ayurvedic. I go and take Ayurvedic. Someone says go to that Baba, go to this puja, that puja. I did all the thing. Credulous, yes, credulous. I gave arsenic 0/4 BD for 1 week. Why 0/4? Why 0/4? Yes, you can take suspicious. You can take suspicious. Yes, as it is skin complaint and main aspect of the progressive disease. I always use LM potency in progressive disease. Zero by 4 is equivalent to 30. 0/1, 0/2, 6, 0/3, 0/4, 30. So I start with 0/4. LM 0/4, yes, LM potency. But thermal is hot. What I say? Then one aspect never change the remedy. So many times in my practice, the patient is through and through calcarea carb, through and through. You cannot think anything about calcarea carb. But what to do if patient is hot? What to do? Will you give calcarea carb or not? Or will you give calcarea salt, calcarea iode? I believe that thermal and all the aspects are very important in acute disease. so many times in chronic disease or any another disease. Remember? The thermal get changed after so many remedy or so many disease, especially in thyroid disease or endocrine disease. Thermal gets changed. If patients are under allopathic medicine for long time, thermal gets changed. So I never give importance to thermal. In especially in chronic disease. If it is acute disease, surely I give importance to thermal. Desirable, I give importance. Now let's see the after medicine what happened. This is soul. This is arm. Can you see the hand? Just remember the previous slide before medicine, his condition. Can you see? Still, he is in home, his home. Complete clear. Can you see? Now then, he came to my clinic one day by driving his own Activa and asked her wife to sit on the back seat. I don't want to sit on the back seat. He drove Activa and came to my clinic. Can you see? This is power of homeopathy. Homeopathy can do anything. Just believe in yourself. Believe in homeopathy. Be humble. What Dr. Raj said. Be humble. The safest place in the world is to be in someone's prayer. Take blessings from all. Okay. Blessings of patients are very important. Satisfaction of patient are very important. If you have any doubt, you can ask me anything. अगर चांस मिलता है नेक्स्ट टाइम तो और केस दिखाएंगे. Potency in water potency or water potency, yes, in water potency, and frequency OD once in a day. Any doubt? Only zero. I start. Usually I start with the low potency. No shot we can repeat in LM. Yes, I have LM potency of all the medicine from ABs to Zincum. 1M is how much LM? 1M is 0 by 8. 1M means 0 by 8. Just write down this 0 by 1, 0 by 2 means 6x. 0 by 3, 0 by 4, 30. 0 by 5, 0 by 6, 200. Then 0 by 7, 0 by 8, 1M, and so on. Not able to use rubrics or repetization. I don't get you, Dr. Vishal. LM medicine just dissolve 1 or 2 poppy side of pill in 200 ml of water. That's it. Then take 4 spoon of regular water. Then add 2 spoon of LM potency. Mix them and give to the patient. And before mixing, do 10 times succussion on your hand. You give directly LM potency. No, I prepared that water potency in my clinic and then give to the patient. Infant potency in infant, it is depend on the case. 30, 200, even I have used 1M, 10M in infant. How much per dose? In LM potency, 1 dose every day. And if it is centesimal, then 30 or 200, just give 1 dose and they give rubrum or SL to the patient for the satisfaction of the patient. If LM potency, if repeated in the same potency, will not it occur the path of the cure? No, 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 no. What if you every day when you sucker it, there is an increase in 1, that 0 by 1, then 0 by 1.1, 0 by 1.2. it increase every day. The first index finger, both hands are not getting cured. Is there a rubric of psoriasis of first index finger? Should I consider it? If you don't get the whole picture of the patient, you can take rubric of psoriasis of first index finger. You can take this rubric. That's the way. Open extremity, eruption, psoriasis, fingers. Okay. Second index. Index in repertory language, index finger means second finger. First finger means thumb. Or you can just say the extremity, psoriasis, finger. There are only 7 remedies. Now you have to change, retake the case. Just retake the case. Anyone? Hmm? Just don't or never stuck with one method. Just change the method, change of according the case. We never get cases only in one method. Are keloid curable? It is very difficult, Dr. Raziana. Some of my patients cured by homeopathic medicine is very difficult. What was the time frame from the first set of photo and second photo? It is 6 months, 6 to 8 months, 6 to 8 months. Lipoma is curable. Yes, yes, yes. Just learn when in homeopathy we always learn that when to give medicine, but just learn when not to give medicine in homeopathy. If there is simple lipoma, movable lipoma, just don't do anything. It will not harm the patient. It is not painful. Don't give medicine. It will not harm the patient. It is very important when not to give medicine. How can we manage viral wart on neck? Only but क्या बोल indicated remedy. Only indicated remedy. Indicated remedy will always work. I never believe in constitutional remedy. I believe in indicated remedy. Degenerative disease, like which diseases? In degenerative disease, we can first stop the progress of the disease. If it will stop, then we can do anything. For example, myasthenia gravis. For example, any other degenerative disease. Lipoma cases, can you tell with the I select the potency according to case. Don't learn potency from anyone. It will come after the experience only. Nephrotic syndrome, yes, very good result with homeopathy. In nephrotic syndrome, especially in children, excellent result. Excellent result. Parkinson disease, first we can stop the progression of the Parkinson. अगर प्रोग्रेशन स्टॉप कर दिया तो भी पेशेंट को बहुत अच्छा लगेगा, नहीं ये आगे बढ़ता रुक गया. Any good potency cases of carbuncle, repeated carbuncle. If you select your medicine on physical symptom only, start with 30 or 6 potency. Remember, if you give medicine on physical patient, recurrent boil or recurrent carbuncle, give on 6 and 30 potency. If it is more deeper, like mental general and delusion level, you can use 200, 1M, 10M. It is depend on which plane the case is. It is on only first plain name, then physical symptom only. Okay. Hernia. In children, we can do miraculous result in hernia. But in adult, we cannot do in hernia because there is no power in muscle in adult patient. This is my experience. This is my experience about hernia. I said just do surgery if patient is adult. We can. This is my experience. It doesn't mean that homeopathy cannot do in hernia. This is my limitation, not homeopathy limitation. Enlarged prostate limit to the hydronephrosis and hydrouria. Yes, we can do with homeopathy. Cerebral atrophy, we can do with homeopathy. Your view on 3x potency, I don't use 3x potency. Involuntary resting tremor. Yes. Yesterday I had case of involuntary tremor. In 6-year-old, this is epileptic tremor, convulsive tremor, constant since last 9 months, constant tremor, like this. 6-year-old girl. I gave lysine. I will show that rubric. Difference between indicated and constitutional. We all give indicated remedy. What is constitutional? अगर आज पल्सेटिलिया दिया लाइफ टाइम वो पेशेंट को कुछ भी होगा पल्सेटिलिया से ठीक होगा. कितने केसेस हमारे प्रैक्टिस में आते हैं कि पूरी लाइफ एक ही दवाई पे रहते हैं. कितने केसेस आते हैं? हार्डली 0.5 or 1%. कुछ भी हुआ give that remedy, patient will be fine. Always we give always indicated remedy. Okay, yeah, आज ये indication है, ये medicine दो. Indication change होते हैं, change the medicine. What is your contact address? This is my phone number. Pro frozen shoulder. Start with the ferrum mat. This is my experience in frozen shoulder. Don't give Rostock. Before also give ferrum mat. If is it in glaucoma, if is it elder or adult patient, don't give any medicine. Yes, ferrum mat in frozen shoulder. Macular degeneration, we can stop at the present level. Ferrum mat potency 200 TDS for 2 days and give SL. Within 10 days, patient will better almost 50%. Fibroedema, yes, extreme, yes. It is cured with homeopathy. Premature ejaculation problem, it is 90% it is psychological. Just counsel that patient. Premature ejaculation क्यों होता है? Due to performance anxiety. 90% of the patient. Just counsel the patient. Repeated carbon craft, you can give anthracenum. Excellent remedy. Anthracenum. Even it is given the side effect of vaccination. Ankylosing spondylitis, excellent result with homeopathy. In allopathy कुछ नहीं, steroid दो और HCQS दो for ankylosing spondylosis. There is no another treatment. Oligospermia, yes. I had so many cases of male infertility. Even in azoospermia, zero sperm count. Polycystic kidney disease, patient get better. If 57 years, ulcerative colitis, आंख बंद करके 100% ठीक हो जाएगा. Ulcerative colitis. Give patient remedy, 100% ठीक हो जाएगा. Any day. Very good. Disturb sleep after death of the wife. What was the feeling? Just ask about feeling. What was the feeling when you heard the news about your wife death? If patient is so happy, it was my most happiest day, that wife day. Give cough, yeah. I had one patient. Give cough, yeah, and she was much better. He was much better. Please recommend book. I want to solve the case. Read from every book. Soul of Remedy, Boric Materia Medica. I use Patak Materia Medica a lot. Clark Materia Medica. Just repertorize the case and then match the remedy in the Materia Medica. Don't give direct remedy. Okay, pulsatilla, give pulsatilla. In 90% of the case, sulfur will come first. Lycopodium will come first. Pulsatilla will come first. Calcarea cup will come first. Okay, fine. So we end this session here. If you have any doubt, you can ask me on WhatsApp or Instagram. Thank you. Thank you so much.
Yes, thank you for sharing your experience and how to convert the patient's expressions into rubrics, repertory. Thank you for sharing your experience in the pathological cases.